Hello, everybody, and welcome to another episode of Stay Connected at the Senior Center with your guest host here, Michael Hirsch. I'm the Medical Director for the Division of Public Health for the City of Worcester, and I've served as the Chief Pandemic Information Officer. And, I may be losing that job. It seems like now, here we are in September of 2022, and we learned last month that the CDC feels that we can kind of stand down a bit from the various protections, mitigations, and interventions that we were doing to try to stop the spread of the COVID virus. Now, it's not to say we're not going to have to revisit this. It's not to say that what the CDC said is permanently there and it's irreversible. That's not how pandemics work. But we've been through a few of these Omicron variant mini surges. And though a lot of people did get sick, some of them for the second time, some even for the third time, it didn't give us the knockout punch that we got when we first got invaded in March of 2020, or when the big wave came of the Omicron variant in December of 2021. Those were huge hits, and we seemed to weather the storm these last few surges, mini surges. I would call them upticks more than a surge. And it seems like the variants keep coming through. Each time they come through, they seem to be a little bit more transmissible, so it's easier to get them, but it's also packing a much less severe punch. So it's not clogging up the emergency rooms and clogging up the hospitals and clogging up the ICUs and clogging up the morgues. It's not doing that now. So the CDC recommendations were that if you got exposed to somebody that you know has COVID, that if you were not symptomatic, you don't have to quarantine anymore. You could wear a good mask, and they prefer you to have either a KN95 or an N95 mask, and wear that wherever you have to work or go to school or go shopping, go out for 5 days. And if at the end of that time you're not symptomatic, you just take a test, make sure that it's negative, and then you can go about your business. And the mask is optional. If you are symptomatic and have been exposed, you can test on that same day. And we're talking about those home antigen tests. The antigen test information is interesting. If the antigen test is positive, well, then you have COVID. If the antigen test is negative, you can't stop there. You have to take another test in 48 hours. And if you're still symptomatic and it's still negative, you have to take another test in another 48 hours. If you don't have any symptoms after initially feeling like you had symptoms, you still have to wait 5 days to take another test. So it's a little bit confusing. It's all in the website for the CDC, and now it's on our website as well. But the main point is that we don't have to quarantine like we did. And the takeaway message was COVID is here to stay. It's going to be with us like the flu is. Starting in the late fall, I think that we will be embracing a new booster that really deals with the Omicron variants, not the original COVID virus. So that shows you how far we've evolved. It's getting to be like when the doctors each year decide which flu strain they think we're going to be seeing, and they put the works into the flu vaccine against the most likely flu strains. That's what the scientists are going to be guessing each year about which is the most likely form of COVID that's going to come down the pike. So This is all good news. I would still say don't throw your masks away, because if you still are one of those high-risk patients, you have immune-compromised disease, you're older than 65, you're in a situation with heart or lung or diabetes problems, you still have to be wary of being in very, very crowded indoor places, or even very, very crowded like concert venues or outdoor dining where you're very cramped. You might benefit from keeping your mask around, especially if you're living with other people with the same kind of problem. Then you're not just protecting yourself, you're protecting your loved ones at home. I think the biggest challenge for us this month in September is observing how much of a change we get when all the college students come back from wherever they live or wherever they spent the summer, and all the kids coming back into schools. The CDC is not recommending masking anymore, not recommending increased social distancing, still recommending good hand washing, and everyone is recommended, whether it's about work or about playing on a team or going to school, if you are sick, do not go into work, because that exposes other people unnecessarily. If you're sick, take your test at home, or get mommy or daddy to take a test for you at home, and if you're positive, then you know what you have to do. You have to isolate, but the rest of your family doesn't necessarily have to isolate. So this is how we're going to go forward. We're not declaring victory against the pandemic. I guess we're declaring some kind of coexistence where we're going to live with the virus. And it's going to be one of those viruses that doesn't go away. It's going to be around. Are there other concerns we have with infectious diseases? Yes. I started talking to you about this last month with the arrival of the monkeypox virus. Monkeypox virus was not even really recognized until 1958, when it was found to be in monkeys in a lab. The first human case was not recognized until 1970, and it began to take root in two areas of Africa, the Congo Basin and West Africa. And mostly it stayed there. But something this past spring in Europe triggered an outbreak, mostly in the gay community of males that have sex with males. There must have been some larger parties, some larger conventions, or kind of frolicking by the sea, whatever it was. That's how it began to spread to many countries, because the people that went to these events were from all different countries, and it came to our shores. We here in Massachusetts have had our share of cases, but monkeypox is not COVID. They're not really anywhere near the same. COVID can be deadly. Monkeypox almost never is, unless you have an immune-compromised problem. It's not sexually transmitted, but it is transmitted by very intimate skin-to-skin contact between someone who has the monkeypox symptoms or rash and someone who doesn't. So the sequence is, if you get exposed to monkeypox and you get monkeypox, you first start out with viral syndrome like headache, fever, stiff neck, enlarged lymph nodes, and then it morphs into you getting a rash. The rash starts out first as red spots, then they become little red blisters, and then they become blisters containing pus. They're called pustules, and they're all over your extremities, can be on your trunk, can be on your neck and face. It looks very alarming when you see a full-blown case, but the good thing is that after about 2 weeks of having this rash, the pustules scab and these little crusty scabs then fall off. And when they do, no scar remains. The only time there is scarring in monkeypox is if the itchiness of them make you scratch and you get a bacterial super infection on them. So if you would, God forbid, know someone who has it or you have it yourself, don't scratch. It's very uncomfortable from everything that I've been told, and it can be a long month because you also have to isolate during that month to avoid giving it to other people in your house, in your lives. But at the same time, it's not deadly. It's not going to kill you. So we have a vaccine here in Worcester. It's being distributed by AIDS Project Worcester. And you have to call their number and they will set up an appointment for you to get the vaccination. Who should get the vaccination? The vaccination should only be given to people who think they had a contact that had monkeypox, who have had multiple sexual partners in a venue that some people have monkeypox, and in a situation where you maybe were handling the bedclothes or the bedding of someone that has monkeypox. So if your housemate or if you're the maid for someone who had monkeypox, that's how it could spread into a different population. There have only been 2 cases of monkeypox so far recorded in children out of over 18,000, but they both had caretakers who were gay men. Now, let me just mention this gay men thing. It's very controversial to say the exact words that I just said, that this is a disease in the group of gay men having sex with men. That's not to say this, that our intent is to stigmatize that population or single them out as being disease carriers. That's not the public health goal, right? The public health goal is to tell the people who are the highest risk that they have to be careful. Be careful not to have multiple sexual partners at this time. Be careful to know your partner and to know that they don't have this rash. And if you are, again, in a situation where you have heterosexuals or children roaming around your house, you have to know enough not to let them touch your bedclothes or your bedding. So when we started out talking about monkeypox about 6 weeks ago, people were upset when the words gay men were used as the highest risk group, but that's what it is. And the CDC initially said we don't want to sound homophobic, which I never had the intent of sounding like. And then they switched and said now saying that it's in the population of gay men is actually straight talk. So I've always tried to do straight talk with you, and I'm not going to pull any punches. This is the group that needs to know about the worst. You know what has been frustrating for me is that the people who are the most worried about monkeypox, who call into our hotline at the DPH or write into our Facebook page or to our web page, are not in that population that is the highest risk. It's everyone is worried because nobody has been willing to say this is the risk group. So it sounds when the World Health Organization or the CDC says anybody can get this. Yes, it's true, anybody can get this, but that is not what we are seeing on the street. Not just here in Worcester, but all over the country. We're just not seeing everyone getting it. We're seeing a very discrete population get it. And they just need to be warned directly, honestly, and without kind of sugarcoating stuff. So if you're a gay male and you have concerns that you were exposed, call AIDS Project Worcester. If you are anyone and you feel like you've been exposed, you can call that same number. If you are living in a household where there are children that are in contact with gay men that might be high risk, be careful if they do develop a rash. This could be the way monkeypox starts. So that's an example. It's not a pandemic. It's not even an epidemic yet, but it is a health emergency because we're behind in getting the vaccine out. This seems to be a chronic problem of public health, is that we don't have enough stores of these various vaccines, and we get behind when they first break out because we don't have enough distribution of the vaccines. But we are catching up, and we're catching up at a faster pace than we caught up during COVID. And I bet by the time we're listening to this Stay Connected episode, this will have died down. That's my hope. So those two viruses, COVID and monkeypox, very different. One deadly, meaning COVID, monkeypox not, but it's not a walk in the park because it causes so much pain and itching. But monkeypox much more self-limited than COVID. And that's the big problem with COVID. Is COVID going to stay self-limited? It's estimated that almost 20% of patients that have had COVID, and particularly ones that have had it more than once, are suffering what we talk about as long COVID symptoms, either chronic weakness, poor lung function, altered taste and smell, altered sensation, weakness. There are a lot of symptoms to long COVID that actually make it seem almost like you would get in Lyme's disease. Very variable who has what, but you know, that's a big percentage. 20% of the people having COVID, having long-term symptoms, is a very concerning thing. That may be what public health is doing for the next 20 to 30 years, is sorting out all those long COVID patients. We at the Board of Health in August started to address monkeypox, and we started to address the other issues that we want to cover moving forward in the calendar year. And it's a heavy lift. We're going to be talking about gun violence prevention in the wake of all those terrible shootings in the spring in Uvalde, Texas, and in Buffalo, and it's a very controversial topic, but I think there's some good remedies, or at least some good things that we can support as a City Department of Public Health. So stay tuned to the next meeting we're going to have is in September, on the 19th of September. We also talked about the threat to reproductive rights that the Supreme Court precipitated in the spring. And that's going to be a very important agenda item. And then we also are going to be trying to talk about climate change and what we in Worcester could do to promote green solutions to a lot of the problems that we're facing. I think the passage of the Inflation Reduction Act, which had so much in it about reduction of carbon emissions, is a huge win for society at large. And there's so much more that could have been done, but they made a compromise and got the bill passed. But I think in the meantime, we in Worcester could potentially get ourselves more green. I know in the hospital, there is so much waste of material, everything coming triple wrapped, and of course it has to be sterile, I get it, but there's so much junk that we have to chuck in the basket every day. We could certainly do better, and that's something that I know that several of my colleagues at the hospital are enthusiastic about starting up again. So as far as these little podcasts go, I'm going to continue to do them. I don't think that we'll be quite as alarmed about COVID-19, although, you know, we've seen it make surges in the spring and now in the winter, and I can't predict when the next big one is, but if you keep up to date with your vaccinations, with your boosters, that's going to be very important to help us kind of finally get out of this. September is going to be the month where we, you know, turn over to fall. I think fall in Worcester is the most beautiful season here. It lasts a little bit too short because it seems like winter comes rolling around in November, and but for those 6 weeks from end of September to the end of October, whether you like to do leaf peeping or just take long walks in the woods, there's so much we can do. And I would urge you to take advantage of it, because we need you to be fit, and we need you to, you know, get some exercise in before those cold winter months where everything's so cold and icy and snowy. It's much harder to get around. So less time being a couch potato. I know the urge is there. You want to watch maybe a football game on the weekend, or you want to binge watch a TV show. Carve out a little time every time you can to take a little walk. Doesn't have to be a long walk, you know, 10 minutes, 15 minutes. And, you know, doing multiple walks during the day that add up to like an hour's worth of activity a day, that's a very good policy. And I urge you to take advantage of it. I know we've talked about it in past broadcasts. The Audubon property at Broad Meadowbrook is beautiful. It's a good idea if you are a little unsteady on your feet to bring a buddy with you whose arm you can cling to, or you know, just take it slow. Use a cane, use a walker. You can do all those things on the trail there. It's not terrible, and it's a beautiful venue with all different kind of wildlife that you can observe. I urge you to take advantage of it. Worcester is becoming much more aware of its potential as a walking city. They just completed a east-west trail in Worcester that goes all the way from the Notre Dame nursing home all the way to the west side. And I think it's a great idea to take advantage of those kind of trails. So that's all I really have for you this month. I wish you all, if you are celebrating in the Jewish faith, the Happy New Year, which starts on September 26th. And I hope you have a sweet new year, and that all your dreams can come true. And I know it's a dream for me to be able to talk to you each month. And please be well, and I will see you again in October.